Hi, my name is Jazz and welcome to the Listening Lounge. I've been an audiologist for over 16 and a half years, and today we welcome Dr Yovina, who has done a bachelor's degree, a master's and also a doctorate in audiology. Today we discuss her journey in audiology and the industry as a whole. Thank you so much for joining me today, Dr Yovina. So before we get into our conversation today, what got you into audiology?
Gosh, it's a little bit of a strange one. So I was doing my A-levels at school and I wasn't really sure exactly what I wanted to do. Like, I had initially wanted to be a dentist, but I had kind of shifted from that idea, and it was coming up to the time where we had to do university applications and I didn't know what I was going to apply for. And my biology teacher at school came to me and said, I think you would be really good in audiology because you like to talk a lot. And I was like, well, what is that? And funnily enough, she then proceeded to describe speech therapy to me and described kind of what a speech therapist does, thinking that's what an audiologist did. But I ended up looking into it and I was like, you know what, this is interesting, because I knew I definitely wanted to go into healthcare. I really liked the psychology aspect of things. I really liked the science aspect of things. It just seemed like a perfect blend of psychology and science. So I applied for it, not really knowing much more than that, and luckily just ended up loving it. So that's how I got into audiology.
Good. So you've done a degree, a master's and a doctorate. So you actually are a doctor of audiology.
Yes.
But what makes a good audiologist?
There are so many things I think that make a good audiologist. I mean, basic first and foremost, I think, is just knowing your stuff, knowing your theory and all the things that step by step you need to do as an audiologist. But I think equally as important is just being a person who genuinely cares, genuinely listens to their patients, genuinely wants to help people, because that is what you are doing day in, day out. You are talking to people, you are helping people, you are caring for people. And honestly, if you have that, if that is part of your personality, if that is something you enjoy to do, you're 75% of the way there in terms of being a good clinician.
Okay. And when you look at some practices, they do slightly different testing than other testing from other clinics. Why is it so different from one practice to another?
I think that's a really good question, because there really is such a variation. I have people come into my clinic all the time. We do a hearing assessment. There's a certain test that I'll do and they'll be like, oh my gosh, no one's ever done this for me before. And that's, there's negatives and positives to that. I would love for standardized care across all practices, but
what would be your standardized care? What would you love to see if you could change how everyone done their testing procedures or what they included? What would that be? What would that look like?
For me, I think, there's very much a culture of, I'm going to go get a hearing test. And what they're thinking of is the classic test that you do where you listen for beeps and you press a button. And that is what is universally known as a hearing test. And whilst that provides us with really, really useful information, that is not a real world experience. And while we may be able to look at those test results and know roughly what that patient may be experiencing day to day, for a patient, I can really understand how if they come in and they say, oh, I'm really struggling to hear when people say things in background noise. By doing a test where you're playing beeps in quiet, that is not really addressing what they're struggling with. I can understand how a patient may have that test and say, oh, but you didn't really test what I'm struggling with. So for me, I would love for speech testing to be as standard.
Okay.
And rather than it being, I'm going to go have a hearing test, I'm going to go have my hearing assessed. I would love that change in language, because then it's very clear that you're going to go have a test battery that are going to assess your needs, rather than I'm just going to go have a hearing test.
Yeah.
Sorry, that was a very long-winded way
No,
of saying that.
no, it's good. And I completely agree with that. So could I get your opinion on real ear measurements, so REMs?
So real ear measurements is a way of verifying that what the hearing aid is doing is what we want it to do. And another aspect to it is that when we set up the hearing aid, we are, through REMs, we are not doing it solely based on your hearing test results. Something that we have to consider are the acoustics of the ear. The reason that this makes such a difference is, imagine a speaker system in a cupboard, right? And you are playing the music at a certain level. Take that same speaker system and put it in a gym. Play it at that same level, it is going to sound very, very different, because there is so much more space that needs to be filled with the sound. In a similar way, there is a lot of variety in ear canal sizes. So we need to take that into consideration to ensure that the sound that we are putting in is reaching the eardrum at the level that we need it to. And that is what REMS does. The reason that it is considered to be so important is because without it, you are taking a average ear canal size, and that is based on a plastic head in a laboratory somewhere in some lab. So we just want to get it as accurate as possible. That is what REMS is. It is clinically, scientifically proven that if you do REMS, you are increasing your chances of hearing aid adoption. Hence, I do REMS daily in my practice. And I do it regularly throughout the person's life of them having a hearing aid, because you just increase your chances so much more of that person getting on with their hearing aids. Do I think it is 100% absolutely essential? No.
Okay.
I don't. Because I do believe that you can eventually get the same result through fine-tuning a hearing aid. It will just take you so much longer.
Yeah.
You know? And you do run the risk of never optimizing the hearing aids for that patient. But is it, you know, if it's the difference between a patient having a hearing aid or not, whether they have REMS or not, I would rather them have a hearing aid.
Yeah.
You know?
And what about in situ audiometry? What are your thoughts on that?
In situ audiometry is essentially the hearing test you do with the beeps and pressing a button. It is the exact same thing, but through the hearing aids. So again, it is a way of checking that the sound that we are putting in is at the level 2 we need to for that ear canal size. I think it's a really good test. I do like in situ audiometry, and I like it as an alternative option if you're not doing a REM.
Okay.
Because it is another way of validating or verifying that hearing aid. It's not the gold standard, but it's better than just clicking and fitting a hearing aid.
Okay, good. And why do you think at the moment there's still a stigma attached to hearing aids? I mean, we see all sorts of people wearing Bluetooth headsets, headphones, AirPods, etc. Why is hearing aids still a thing that it still has a stigma attached to it?
I don't think there's any real simple answer to that, because I think it's such a complex issue. I do think the stigma is decreasing. And for me, what I think the reason behind that, Ollie Luke talks about this a lot. We're seeing a shift in the generation of patient coming into us, you know? So, you know, we are going from having a generation, I think he calls it the silent generation, into the boomers, who are so much more open, and they've grown up in a different era where there's just more technology available. And I think there is now so much more of a realization that if you have a hearing aid, it is just going to improve every aspect of your life if you have hearing loss. So I think that's one big aspect of it. There's a shift in generation who are coming in to see us. I just think also there is so much more information out there, and there's so much more access to information out there. So we have so many more celebrities, for example, who are open about their hearing loss. We have so many more just like people online sharing their experiences. And those are younger people as well, people in their 20s and their 30s who are open about having hearing aids and what their experience is. So I think all of that is just increasing people's awareness and people's openness to it. Because if you see it more, you're going to accept it more. And, you know, into that also comes how much more advertising we have around hearing aids. Controversially, that may not be a good thing, but we have so many brands like Boots and Specsavers, for example, who are now advertising on bus stops and on buses and on the TV about hearing aids. And it really is, the more you see it, the more you're going to accept that.
Yeah, no, yeah, I completely agree. And I think maybe the language around it needs to change. I think that's quite a big thing as well, like hearing aids.
I hate the name hearing aid.
Yeah.
I hate the name. I've done many a video on it, but I hate the name hearing aid.
Yeah.
I just think, you know...
What do you call them in your practice?
I do call them hearing aids because that is the universal name for it.
Okay.
But I actually had a patient who came in, and it was after his hearing aid fitting. It was his first follow-up. And he's a bit younger. He's like maybe in his 50s. And he said to me, he was like, by the way, I don't like the name hearing aid. I'm not calling it that. Everyone around me has to call it my audio tech.
Oh, nice.
So he was like, can you call it my audio tech?
Yeah.
And I was like, yes, absolutely. And then later in the appointment, I slipped up and I called it a hearing aid. And he was like, no. It's my audio tech.
I like audio tech. We use hearing tech here. Audio tech, yeah, I love that.
I actually did a poll on one of my posts of which name people like best. I think it was between audio tech, hearing tech, listeners, earbuds, and hearing pods. Listeners won.
Yeah.
People really like listeners.
Yeah.
Maybe we should petition for change.
Yeah. Exactly. I do like that. Nice. Okay. Going back to clinics and how they do things differently, there's also a different price attached to different clinics and how much they charge. Why is that? Why is it so different from one place to another, do you think?
I think there are so many reasons for this. Again, there's no one simple straight reason.
Yeah.
For one thing, there is national chains versus independents. Obviously, when you are a national chain, you do have a little bit more flexibility on how much things cost. You know, for example, Boots, they're not just an audiology practice or a hearing clinic. They also have a pharmacy aspect. They also have an optical aspect. All these other things that can almost hold up the hearing aspect of their business. So they're not just relying on revenue from hearing aids to hold up their business. They've got so many other parts that can feed into that and hold it up. Hence they can charge a little bit less. They can be a little bit more competitive on their pricing. However, along with that, most of the people, and I don't want to use a blanket rule here because it is not a blanket rule, most of the people who work at a national chain tend to not have further clinical aspects to their training. Again, that's not a blanket rule. That's not going to apply for every person, but for the most part, most of them don't have master's degrees or doctorates. Many of them may have foundation degrees or bachelor's degrees, which does not make them any better or worse. It just means they have a different level of training. Versus independents who, you know, obviously we're here in this beautiful clinic, you know, when you're purchasing a treatment plan or you're purchasing hearing tech, you're not just paying for that. You're paying for the environment that you're in. You're paying for your clinical expertise, and your clinical expertise is going to be worth whatever you deem it to be worth, based on your training, based on your 14 years of experience, based on anything else that you want to put in there. You know, it's going to be what you feel you are worth, and that is going to vary from place to place. You know, a clinic in Newcastle are going to have a different level of expenses to a clinic on Harley Street.
Yeah.
And that's all going to play into how much a clinic charges.
So in terms of if someone's watching this and they're looking at going to see an audiologist, what are the things that they need to look out for in terms of, because I think this is the thing, it's not just you have hearing aids and that's it, off you go and that's it.
Yeah.
This is a lifelong kind of relationship that you build up with your audiologist, you know. But yeah, what advice would you give to someone in terms of when they go and see someone, what to look out for, and if they don't feel comfortable in someone's ability, what should they do effectively?
So
there's a lot of questions.
No. It's really, really important though, because there is this culture of, I'm going to buy a hearing aid, it doesn't matter where I get it from.
Yeah.
And, you know, funnily enough, yesterday in my clinic, I saw a gentleman who had called me up, and he had said, I'd been struggling with my hearing, and I looked online and I saw this device on Amazon, and it was much more reasonable than other hearing aids I've seen online. It told me the name of this device. I looked it up, and it was an OTC from China.
Okay. Which is over the counter for anyone watching.
Sorry, yes, it's an over the counter device, not a prescribed hearing aid. However, he had purchased it thinking, I've got a great deal. This is equivalent to a prescribed hearing aid. And he called me up and he was like, I bought it. Now I'm a bit nervous. I don't even know how to put it in. I'm just looking for someone to help me. And I was like, you know what? Like, even though you've not purchased this directly through me, I would rather you use something safely. I'm happy to see you. Made it very clear, I'm not going to be able to adjust this device or do anything with this device. But you want to know how to put it in, I will show you how to put it in.
Yeah.
And he came in, and this device, we put it in as it would just whistle absolutely non-stop.
Right.
But this was the problem, right? He was like, I think I need a hearing aid. All hearing aids are the same. So I'm just going to find something online for
X amount
of money, which is it is much less than a prescribed hearing aid.
Yeah.
But I've just gone on such a tangent, I forgot your question.
Oh, I can't remember it myself now.
What should people look out for? Sorry.
It's okay.
So that is one issue. The culture of thinking I need a hearing aid, I'm just going to get a hearing aid, doesn't matter where I get it from.
Yeah.
There is so much more that goes into it. In order to have a good experience with a hearing aid, you need to have a really good assessment from a clinician who understands your lifestyle, your needs, what you want. Because I can sit here and say to you, Jazz, these are your hearing levels. This is the hearing aid you should get. But if I say to you, if I show you something and you're like, I am never going to wear that, then what is your benefit going to be? You know, it's not going to work. So it's got what you want has to be taken into account as well.
100%.
Along with that, you've got to have the right hearing aid for you. There's a lot out there. There are a lot of manufacturers. There are a lot of models. There are a lot of styles. It's an absolute minefield if you don't know what you're looking for. Because, you know, you can go onto Forbes, you can go onto the internet, you can go onto hearingtracker.com and they're going to provide you with a list of the top 10 hearing aids of 2026.
Yeah.
The number one hearing aid might work great for one person. It might not work great for you. It's not the same as buying a car.
Yeah.
You know? So you got to have the right hearing aid. But then that hearing aid has to be set up appropriately for you.
Yeah.
And that is something that is so underrated. So underrated.
Yeah.
You know, for example, I could have two patients sat in front of me, the exact same hearing loss, but their lifestyles may be so different, you cannot give those two people the same settings.
Yeah. No, completely.
You know? So I would say those are the main three things that go into having success with hearing aids. So when you go into a hearing clinic and you are going into having an assessment and you are considering purchasing hearing aids, you've got to look at the clinician. You've got to look at the hearing aid that they are proposing to you and whether you can ask them. You can say, they might say you should have a Starkey Omega AI RIC, which to most people might not mean a lot. But you can say, why? Why should I have that hearing aid?
Yeah.
What about you have learned a lot about me today. Why is that the best one for me? Why not XYZ other hearing aid?
Yeah.
And then you've got to know what their plan is for fitting that hearing aid to you. And are you happy with that plan? So, short answer to this very long answer I have given you, have a clinician that you feel comfortable with. If you in any way feel you are being sold to, if you in any way don't feel comfortable with this person, that is not the right clinician for you. They might be a fantastic clinician, but if you aren't comfortable with them, then are you really going to be able to be comfortable coming back to them when you have a problem and saying, I have this problem, can you help me? Are you going to feel comfortable enough to do that? Make sure you understand what hearing aid they are offering you and why. And make sure that you are happy with their care plan for you. Those are the three things you've got to look out for. If you've got those right, you got a pretty good shot.
Completely agree. And I think it's not a bad thing for people to get a second opinion if they don't feel comfortable with whoever they've gone to see. And asking questions, I think, is vital. Why are you prescribing that, like you've said? Because you need to understand that. Because like you said, it is a minefield. There's so many different hearing aids available. I mean, I've had people come in and say, my friend's got this hearing aid and I want the same because they're getting on really well with it. But obviously your friend has a different hearing loss to you, different lifestyle to you. So it's not one size fits all with that. So I think that is really, really important. And to ask as many questions as possible as well.
Yeah.
What are your thoughts on OTCs?
My thoughts on OTCs, I really, really feel they have their place. Some clinicians are really worried about them and I really don't think they need to be.
Yeah.
you've got a lot of different OTCs out there. So you've got, you know, for example, the Nuance audio glasses. You have, you know, Bose came out with them for a period of time. Apple is classed as an OTC device. They got FDBA approval to be called a hearing aid. They're an OTC device. They are not a prescribed device.
Yeah.
You know? So some clinicians really feel, oh my gosh, it's taking something away from us. I really, really don't feel that way.
Same.
For one thing, most OTC devices are suitable for mild to moderate hearing losses only. So if you have anything more than that, likelihood is they're not going to cover your hearing loss. The other thing is as well is there is such a big jump from not having anything to purchasing a hearing aid. That's a big jump. You're going from 0 to 100 right there.
Yeah.
Even with an NHS hearing aid, you've got a big jump from not having anything to I now wear hearing aids on the daily, mentally. You know, there's a lot of acceptance and, you know, coming round to that idea. I really feel like OTCs are like the perfect middle ground, you know, in terms of how that might feel emotionally to wear, how that might feel expense-wise to purchase. It's a lot more palatable in every single way. So I really, really feel like, you know, they're the perfect first step. For example, my own dad, he was like, you know, I'm starting to struggle a bit with my hearing. So he wore a pair of Nuance audio glasses for a few weeks. And then he came to me and he said, you know what? I've tried these out. I've worn them for a period of time. I'm ready for the next step. And I think that's what OTC devices can provide. It's something you can try in the meantime until you're ready for the next step.
Yeah.
So I don't have an issue with them. I actually think they're really going to help us as clinicians.
I did have a client yesterday that came in that did try some OTCs and wasn't happy with the sound quality, and he kind of was very reluctant to come in for an assessment because he thought, okay, this is how they're going to sound, but I'm just going to be spending X amount more. So it kind of put him off having them.
I can understand that. And I think this is the issue we were talking about earlier, which is there is a lack of information out there on the difference between an OTC device and a prescribed device. And I think if we can all as clinicians accept that OTCs are here, they are staying, and they have their place, and just being open about it, then we can all provide more information about it rather than pretending they're not there, which is what I feel like a lot of people are doing. They're kind of pretending they're not there. But if we're out there, we talk about it more, we educate people more on this is the difference, this is what you're going to get with an OTC, this is what you're going to get with a hearing aid, then it can only benefit everyone, and people will be more educated and be more informed about the decisions that they're making regarding them.
Completely agree. My worry about OTCs is that if you have someone that has, I don't know, a unilateral hearing loss or asymmetry in their hearing, and they just think, oh, I'll just get this and this will get me through. Well, we need to figure out why you have that asymmetry or, you know, unilateral hearing loss, and that might get missed. That's the thing that I'm
Do you mean
just
if
thinking,
they've not had their hearing assessed before?
And they just think, oh, I've got a hearing loss, I'll just get these over-the-counter devices and this will just see me through.
This is where we also need to have more regular testing for people.
100%. But that's my concern, that people that aren't getting tested are just going to go and just get an OTC because they feel that it's going to benefit them, and then something's going to be missed.
I don't know why there is so much more of a thing of people buying OTC devices with their like never having had their hearing tested. But you would never buy a pair of glasses without having your eyes tested.
No, of course, I know.
Because it's like, how do you know what you need? How do you know what prescription you have and things like that? So I don't know why I agree with you. Like, it was the exact same thing with that happened with the patient I saw yesterday. He actually had wax in one ear.
Right.
That he thought was the hearing loss.
Yeah.
But and he'd never had his hearing assessed before. He'd never had his ears looked at before. And I don't know why it's such a thing of, I'll just buy it and try it, but you actually don't know where your hearing stands.
100%. Yeah.
You wouldn't do that for anything else.
No. Yeah.
You'd never buy a car without driving it.
Well, you'd hope not. Yeah.
Yeah.
Why don't people get their hearing tested regularly? You get your vision tested annually every 2 years. You get your teeth checked regularly. Why is hearing not one of those things? And why is it always considered an older thing that you have to be old to get your hearing tested?
I really think we're just not taught to. It's not talked about.
Yeah.
Or if it is talked about, it's talked about in the relation of older people. Hence why I don't blame people associating it with getting older, because the marketing that you see is all older people.
Yeah.
When you talk about getting your hearing tested, I will admit it, like 70% of the patients I see are over the age of 70. A couple months ago, I fitted like a 104-year-old, you know.
Wow.
I know, it was really impressive. And she didn't look at it at all either. But it's everything we talk and do about with like people with hearing loss is in relation to older people. But you can have hearing loss at any age. It is the number one most common disability out there. I know there's a little bit of controversy about whether it is a disability or not. But in the context of the World Health Organization, it is the number one most common thing out there. And it is something that naturally happens as you get older. Yes, there is absolutely that. But I really feel there is no harm in getting your hearing checked at any age, if for nothing else, to get a baseline.
Yeah.
You know, I have had it several times in my clinic where I've had a younger person coming in and they've said, I just feel like something's happened to my hearing and I'm not hearing as well as I was and things like that. And we assess, we do a test, and I'm like, okay, your hearing is normal, but maybe your hearing is at like the bottom end of normal. Maybe before that, your hearing was at the upper end of normal and your hearing has changed, but I have no way of knowing that because I can only see your hearing as it stands today. It's one of the limitations we have of hearing tests. We can't see where it was before and we can't see where it's going. We can only see your hearing on the day. But if more people were having their hearing tested more regularly, in the way you do your eyes, maybe you get your eyes checked every 2 years. If we did that regularly, we would just know where people stand more, and therefore we can advise and we can help better. For some reason, we have this system where you have your hearing checked on the day you're born and then not again until you're 60 years old.
Yeah.
You know?
Yeah. If you could change one thing in audiology, and you can name a few if you want to, what would it be? Or what would they be?
Number one, more people getting their hearing checked regularly. You don't have to be a certain age to get your hearing checked. You can have your hearing checked at any time. It is never a bad idea, ever. There's no harm in doing it. It is safe, it is painless, and it is maybe an hour and a half out of your day. That's it. Not bad at all.
Yeah.
The other thing is, I would just like there to be so much more transparency around qualifications in audiology, because it is such a minefield. There is such a range. For one thing, the title of an audiologist is not a protected title. anyone can call themselves an audiologist. Anyone. The only titles that are protected are hearing aid dispenser and clinical scientist. To my knowledge, if you are working in the private practice, you can only be registered as a hearing aid dispenser. You can't be registered as a clinical scientist because then you can't sell hearing aids. So by that effect, and I'm not saying this in any way to say that I am better than anyone else, I have done 7 years worth of degrees in audiology. My title, in terms of protected title, as a hearing aid dispenser, is the same as someone who has done a 6-month foundation degree in dispensing hearing aids. We have the same protected title.
Yeah.
Hence, I think there is a lack of transparency for people who are coming in to know who they are seeing and what they can do. You know, we may do very similar things for someone who has a mild to moderate sensory or hearing loss that is the same in both ears. But in terms of someone who has maybe more complex needs, there's a huge difference. And then how do you know who you should see when everyone has the same title and everyone is calling themselves an audiologist or everyone is calling themselves a hearing aid dispenser?
Yeah. No, I get that.
I just think, and I think that's something that a lot of patients don't know either. I think they don't realize that you could have someone who's got a foundation degree in dispensing hearing aids. You've got someone who could have a bachelor's degree in audiology. You could have someone who has a master's degree in audiology, but there's 2 types of master's degrees. There is a master's degree, which is like the equivalent of a bachelor's that you have just done as a postgraduate because you've done another degree first. Or you've got a master's that's an extension of your bachelor's degree.
Yeah.
And then you've got like 6 different types of qualification that people could have. And I think it's important for people to know.
No, of course. Going on to that a bit further, and wax removal, and not always being conducted by ENT or nurses or audiologists. What are your thoughts on that?
With wax removal, it is not a regulated practice, which means that literally anyone can remove wax, right?
Yeah.
You can do a 2-day course and you could do it, an audiologist could do it, a barber could do it, a nail technician could do it, literally anyone. And my feeling on that is the barber or the nail technician gonna have as much of an understanding of the anatomy of the ear and what they are looking at and what they are looking for as someone who has a qualification or experience in audiology and ears, you know? And the systems of the ear are so delicate. They are so tiny. There is a real risk. A risk of doing permanent damage that could literally change your life. You know, all it takes is someone going too far or one wrong move and you've got a perforated eardrum.
Yeah.
Now, some perforations do heal. Some don't. And that leaves you with very real effects that could change your entire life. You know?
Completely agree.
So I do, and there are associations out there who are campaigning for regulation in wax removal. Unfortunately, I think it's going to be a very long time before we see any real change in that.
Yeah.
So my advice to anyone out there is think about the risks and then make your decision on where you want to go.
Yeah. I don't think people are aware that you do you can do a 1 or 2 day course, and then that, gives you the possibility of removing wax. You don't really need to have that much experience in it and just go on and off you go. And I think that needs to be made aware quite a lot, because there are things that I'm still seeing in the ear that textbook I know about, and but I haven't physically seen, and I've been an audiologist for 16 and a half years. So I think there needs to be more awareness of that, of where you go. Just because someone's offering a cheaper service doesn't necessarily mean that they're going to be doing the same service as going to see someone that is more professionally qualified to do it.
Yeah, I would actually compare it to, for example, Botox and fillers. Not a regulated service. You could have your hairdresser doing it, you could have, again, your nail technician doing it, or you could have a doctor in plastics do it. For some reason, I find that a lot of people, because it is visible and because it is literally on their face, there's much more of a thing of, I'm not going to risk it, I'm going to go to the doctor in plastics, because they know more about it. They understand the anatomy. They know what they're doing a little bit more. For some reason, people don't seem to think that in terms of microsuction.
Yeah. Okay. Yeah, completely agree. What needs to be left at the door with audiology?
It's going to be the same thing I mentioned before. The idea that it is all about the hearing aid and which hearing aid you buy.
Okay.
It is one part of like 3 things that are all equal that need to be considered. And I don't blame people for thinking that, because that is what a lot of the marketing is. A lot of the marketing is this hearing aid versus this hearing aid versus this hearing aid. I would really love for people to be like, okay, that is like one aspect. Also along with that, along the same vein, I would like people to allow their audiologist to make the recommendation. Rightly or wrongly, something I compare this to is if you are having, for example, hip replacement surgery.
Yeah.
You're not going to go to your surgeon and say, I want the hip from this specific manufacturer. You're going to allow the surgeon to be like, I'm just going to do my job.
Yeah.
I'm not saying that you should have no knowledge of which hearing aid you should get, but what I'm saying is allow your audiologist to make the recommendation. If you want to ask questions about it, if you want to know more about another particular one, by all means, have that conversation. Have it be a joint conversation.
Yeah.
But what I'm trying to say is maybe avoid saying, I want this hearing aid and this hearing aid only. Because there's a lot more options out there. And maybe something that works better for you. Maybe that's the right one for you.
Yeah.
But maybe there's something that could work even better for you.
Okay. What are your thoughts on auditory training?
Auditory training is a really, really underrated tool. Reason being, when we think about hearing aids and hearing loss, there is a conception out there that as long as you amplify, because there's a misconception that all hearing aids do is amplify. Maybe we can talk about that actually. There is a misconception out there that as long as we amplify to the right levels in the ear, that it fixes everything. It absolutely does not. For a lot of people. Maybe for some it does, but for a lot of people it doesn't. The reason is that although we are amplifying to a certain degree, all the processing of sound happens in the brain. What we're really doing, we're not treating hearing loss in the ears, we're treating hearing loss in the brain. And we all know the brain is a use it or lose it system. And most hearing losses tend to happen over years and years and years before you even notice it. And the brain gradually over that period of time gets used to hearing things at a lower level. It becomes a little bit lazy. And once we then treat that hearing loss with hearing aids, yes, the brain gets all that amplification again, but over time it has lost a little bit of its processing ability. It's lost a little bit of its ability to be able to understand speech and noise and all of these like classic things that people with hearing loss struggle with. And auditory training is like another tool in our toolbox that can be used alongside hearing aids to re-strengthen those processes again. So it's a really underrated tool, and one that I would love to see a lot of clinics use a lot more often.
Great. Yeah, completely agree. Are there any misconceptions about hearing aids?
A huge misconception about hearing aids, and I understand where it comes from, is that they are amplifiers, that they are speakers. I think if people knew just how much they do, they'd be mind blown. Like the amount of technology and processing that goes into a hearing aid is wild. So, you know, it's not a case of you have a 60 decibel loss, let's put 60 decibels of sound into it. Absolutely not. Part of the reason for that is because although you may have hearing loss, your tolerance for sound doesn't increase. If your hearing goes down by 60 decibels, that doesn't mean that you can tolerate 60 decibels more sound. It means that you have such a smaller allowance of sound that you will tolerate comfortably. So there is a lot of compression, background noise reduction, you know, directionality, the processing. There is a reason that millions and billions of dollars goes into research and development for hearing aids. More than I could probably even talk about.
Yeah. Okay. So, Dr. Yovina, what is next for you?
What is next for me? You know, we are about a year and a half into Dr. Yovina Audiology. So that is where a lot of my love and attention goes to. So we are growing that all the time. And yeah, I mean, if you would like to see what I'm up to, I post a lot on social media, not only about audiology and my practice, but things that I like to do in my life as well. So yeah, you can keep up there.
Yeah. And if someone wanted to contact you, how could they get in contact?
Ooh, a lot of different ways. If you follow me on social media, you're more than welcome to contact me there. They come straight through to me. You can also call, you can reach me through my website. So yeah, if you'd like to follow me, it's at Dr. Yovina.
Perfect. Thank you so much for joining us. It's been a great conversation and we've covered a lot to do with audiology. So hopefully it will help someone out there.
Hopefully. Thank you so much for having me.
You're more than welcome.